So, 5 years after COVID, the world is seeing the surge of another virus, the HMPV. If you can tell us about what HMPV is.
See, this is we got an advisory from Government of India recently, 2 days ago, and yesterday we had a meeting on this with the health experts committee that what we have had right from the COVID times. So where actually we have members from different health facilities. So where we also discussed about what is this virus all about, and what has been shared by the Government of India too. We also have discussed. So HMPV actually is a known virus, not like a something not an unknown virus, and it creates flu-like symptoms. So basically, the cause of concern was that whatever the reports that actually the media has brought out is that there are a large number of cases in some parts of the world. So how actually that can have an impact in India. So what we have seen is that first of all we try to look at all the we call influenza like symptoms, like what kind of how many fever cases are there across the state, and are there any trends that there is a surge in those fever cases. So there's no surge, there's no unusual pattern that we can see in our state. So there's nothing to be worried about that one. At the same time, we also have, we also have been using this opportunity to really strengthen our own health system. So basically, just to look at it like how we are, again orienting all the doctors. Basically we are taking those measures to see that to especially to see that especially the pediatric cases, focus on those pediatric cases, making sure that they are provided. They are properly monitored and properly taken care of, so that we will not have any such kind of a surge, further transmission, if at all, if there is any such transmission happens. Currently there is not even a single case or anything that is reported in the state. So there is no immediate cause of concern like on this particular issue. So that's what we have issued an advisory, and so from the health department side to the residents of the state. So that's it about. So it's a it's basically a preparatory kind of making sure that you are you are aware of the issue, and even if there is any eventuality, we'll be able to provide support. So, and also there are not many fatalities, unlike COVID. It doesn't cause any fatalities. It actually, in severe cases, it turns out to be a pneumonia or bronchitis kind of a pattern, but not to the level of the way the COVID has caused. So that's why, just to put everyone, and only one thing what we said is that if there is anyone having a this fever and respiratory illness, they need to be little bit